When you look at day-to-day struggles with ADHD, if I can't focus, okay, man, I can't focus. That's bad. But I'm 40 years old. I've figured out a hack around it, or I've delegated this problem, or I have found like enough coping skills to kind of Frankenstein my way through. But I can't do that with emotions. I can't give that to somebody else. With any task, if there's an emotional component keeping me from doing that task, that's the thing I'm going to procrastinate. That's the thing I'm going to avoid. That's the thing that makes it so much harder for me. So without looking at that as like a greater context about ADHD, I think you are doing yourself a huge disservice, because as a woman, this is what people call anxiety. This is what people call depression. Now you're going through, and these women are like, oh, you feel sad about that? You have anxiety. You have depression. They're started on antidepressants. The people that I'm seeing, sometimes they've been on 10 different antidepressants at this time.
Okay, guys, if you've ever felt too deeply, too quickly, and for too long, this podcast is for you. Half the women listening to this right now have wondered if they have ADHD. The other half of us are exhausted. We can't focus, can't finish anything, and have been told it's just anxiety, hormones, or that they just need to try harder, or that they're just too sensitive. My guest today is going to tell you why so many of you are right and why the system has been failing you your entire life. Dr. Sasha Hamdani is a board-certified psychiatrist and one of the country's leading ADHD specialists, and she almost didn't make it through medical school herself. Not because she wasn't brilliant, but because the very institution training her to diagnose ADHD completely missed it in her. She didn't find out until she was already in medical school, already treating patients. This podcast blew my eyes wide open. I have been told my whole life that I'm too sensitive. When I get rejected, I feel it in my gut. She explained it to me today for the first time. Her new book, Too Sensitive, is out now, and you can follow her on the Psych Dr. MD. Her TED Talk on ADHD brain was one of the most watched of the year. You are going to love this episode, and you're going to learn just as much as I did. We talked about hormones and how they affect ADHD and so much more. Dr. Hamdani, welcome to SHEMD. So on today's podcast, I'm so excited to welcome Dr. Sasha Hamdani.
Thank you.
What I'm so excited to dive in today is very personal, because I am massively ADHD, was completely not diagnosed growing up, struggled through school. It ended up being a superpower. But the emotional side of it, where I've heard that so many times growing up, you're too sensitive, you're too sensitive. And I haven't heard that many people talk about it. I think we talk a lot about ADHD, not enough in women. I think it's often completely misdiagnosed. You get anxiety as a diagnosis, and then you're on anti-anxiety medicine. Let's kind of start at the beginning, because I love the story that you started a riot in the 4th grade. But tell me what happens.
Okay, so 4th grade happens. I think I presented more like a boy, because I was this combination of inattentive and hyperactive. And like school, interesting enough, but if there was downtime or if there was something going on that didn't interest me in that moment, school was really difficult for me. So I had a substitute teacher that day. And now like even telling this story is so horrifying to me, because I have kids and like I love their teachers and respect what they do more than anything in this entire world. I got up on my desk and I got all the other kids to do it. And we were like, started like a full on rebellion. And the substitute teacher was like, oh my God. And so literally it was like, that happens with the substitute tells my teacher tells my mom, like that all happened within like a 4-hour span. And so luckily my mom is a pediatrician in the town we lived in, and she got me into one of the other pediatricians who had known me for a long period of time and was able to evaluate and be like, yes, we've seen this, we know this. And so I was diagnosed with ADHD at that time. What I find kind of unfortunate, but I understand the thought process behind it, is I wasn't told that it was ADHD. So I was diagnosed, I was started on medication right away. Life changed for me. I was able to engage in class. Things were easier. I was able to stay in my seat. I was able to do all those things that was really difficult for me. And I did well enough from 4th grade onwards that out of high school, I got into an accelerated combined undergrad graduate program. So I started med school right at 18. That's kind of when the wheels came off, because my parents didn't tell me I had ADHD. I just assumed I was taking a vitamin this whole time. So I'm taking my vitamin until I get to med school. And I was like, I don't even know where my vitamin is. Like, I don't know. And life was just really difficult.
So you stopped the medication.
Oh, yeah. Didn't even know where it was. I remember feeling so impaired because I had gotten used to in high school. I was like, I'm one of the smart kids. And that was like my whole identity. And so I get to med school and I was like, oh, I'm not that anymore because this is so hard for me. And I remember feeling like something happened to me. I think I had a stroke or something neurological happened to me. And it got to the point where I took a test in neurology and we were looking at like slides of the brain. You had to like identify what it was. Our grades were posted up and it was like by ID number. So I was like looking, over people's heads and I was like, oh my God, some dumbass got 32%. And then I was like, how? I studied so hard. Like, how did this happen? And it was because I didn't flip over the page. I got 100% on one side and then like nothing. So I recognized like something happened. I talked to my parents about it. They're like, are you taking your vitamin? I was like, respectfully, don't know where that is. And they're like, well, it's ADHD medication. I was like, there is no way. There's no way. Because in my brain, what I thought about as ADHD was the hyper young boy, the guy who got in trouble all the time. And there was someone in my class who was that prototypical ADHD. And I was like, there's no way. I'm not that kid. And so I refused to take the medication and I just worked and tried harder. That's when, my dad was like, don't worry about it. Come home. Let's work on this together. And I think they didn't have the verbiage at the time when I was in fourth grade to handle it. And you know what? I was a really sensitive kid, so maybe I wouldn't have handled it well. So maybe they did what they thought they had to do at the time, but they just fully made up for it in med school because I came home. We sat in a library. We sat on the floor of the library and just were like looking at neurology textbooks and psychiatry textbooks and looking at ADHD, what sounds like me, what doesn't. And then I had such a good understanding of that helped me move forward. And then I had to kind of experiment and figure out what medications were right for me. And like, it was a process.
So many women are undiagnosed.
Yeah.
Is it because that we present differently than boys do? Is that the reason? Like when you say, like, I thought, oh, ADHD, that's the boy that gets in trouble all the time. How does a woman listening to this, what are the symptoms that you have ADHD and what exactly is ADHD?
Let's break it down. So like first, ADHD is a neurodevelopmental condition. So this is something that you're born with and it changes and evolves over time. But as of right now, the way we diagnose it, which for the record, I think is very limited, but we'll talk about how it's diagnosed right now. And it's broken down into 3 different types: inattentive, hyperactive, and combined type, which is a combination of the 2. So inattentive, you see symptoms like forgetfulness and disorganization. Someone who is, just daydreaming in class, not generally causing problems to anyone besides themselves. And so this is how women typically present. Then you have the hyperactive. And I think about this as like physical and verbal impulsivity. They're speaking out of turn. They're interrupting. They have difficulty staying in their chair. They're fidgeting. And then there's combined type, which is a combination of the 2. That's where our DSM criteria stands right now. I think one of the big missing components of that is the emotional dysregulation side, which is part of why I think women don't get diagnosed. If we're looking at the question, why aren't women getting diagnosed? Wait, is that what you asked me?
Yeah. So what, is it because of that?
I think also some of the reason why I get distracted within that conversation is because there's so many different layers to it. Part of the reason why women don't get diagnosed is a failure of the educational system and of the psychiatric system because our diagnostic criteria is very limited. I think we talk about ADHD simply as a focus issue when I think it encompasses so much more. And I think you ask literally anybody with ADHD and they will say this goes so much past attention. This impacts my relationships. This impacts my family. This impacts my ability to handle emotions. This impacts how I sleep. This impacts how I eat. It just kind of encompasses a lot more. So I think that's a big limitation. Second reason why I don't think women get diagnosed is because they do primarily present as inattentive, and people have been trained for years and years to look for that hyper young boy because initial studies were done on hyper young boys. And so our system is not calibrated to pick up girls and absolutely not to pick up adult women. So there is this entire generational gap that you get to where these women are getting diagnosed when their kids are going through evaluation and they're like, oh, okay, that does sound like me.
That's me.
Third reason is a hormonal reason. When you get this drop in estrogen, you get a drop in dopamine regulation. And now all of a sudden, your symptoms are getting worse. But you know what happens is that when this is happening, people are like, you're hormonal, you're bitchy, you're anxious.
Right.
This is an exacerbation of underlying ADHD. It's literally everything else that they're getting thrown at them. Fourth reason is women typically get diagnosed with anxiety and depression or a mood disorder or a personality disorder. Everybody is looking for anything else it could be before they think about ADHD. Women get misdiagnosed with anxiety and depression. They start those medications. They stay on those medications for years and years and years and years. And it's only until later and getting their kids diagnosed or the cultural conversation shifting that they reevaluate their medication regimens and they're like, okay, this was wrong. That I got it wrong.
I want to take a moment to talk about something that many women don't realize about pregnancy. In the US, about 1 in 10 babies are born prematurely. And what's surprising is that half of those births happen in pregnancies that had no known risk factors, no warning signs. A seemingly normal pregnancy that ended with a baby born before 37 weeks. And a premature birth isn't always just baby arriving a little early. It can mean weeks in the NICU. It can mean watching your baby through the walls of an incubator instead of holding her. It can change everything about those first weeks and months and can also have an impact for years after that. We know that every additional week in the womb can make a meaningful difference for a baby's development and long-term health. One of the challenges doctors have faced is that traditional screening methods fail to identify up to 80% of preterm births, which means most families simply don't see it coming. That's why I'm so excited to tell you about the preterm test. It's the only clinically validated blood test that assesses risk for spontaneous preterm birth. It's a simple finger prick blood test done between 18 and 20 weeks of pregnancy, and it measures specific proteins in the blood to see if you are at risk for delivering early. The results are shared with your provider so you can have a more informed conversation about your pregnancy and what care is best for you. There's also strong research behind it, such as a large trial called the PRIME study, which included more than 5,000 participants. The results were significant, with 56% fewer extremely early births and 20% fewer NICU admissions. But what those numbers really mean is more time in the womb and more moms bringing their babies home on time. Dr. A uses the preterm test with her patients because she believes it's important for women to know their risk for preterm birth and to be aware this option exists. So if you're pregnant, trying to conceive, or if you know someone who's expecting, this is definitely something worth learning more about. You can visit preterm.com. That's PRETRM.com to learn more and talk with your provider about whether the preterm test might be right for you. Again, that's preterm.com. Talk to your doctor about whether preterm is appropriate for you. SHEMD thanks Sarah Prognostics, maker of the preterm test, for sponsoring this episode. As you know, if you're a longtime listener of SHEMD, I'm always asking our guests who recommend supplements, how do you know what's in them? How do you know which ones are effective and safe? Once you start asking that question, it's hard to stop asking it about everything else in your cabinet too. That's why Momentous created Signature Spec Creatine, their most advanced creatine ever, setting a new standard for creatine quality. The benefits of creatine are real. It supports strength, power, lean muscle growth, recovery, and even improved cognitive performance. It's one of the only creatines manufactured in a pharmaceutical facility using reverse osmosis water purification. And it's purified through an expanded 6-stage testing process for independent agencies. They even fix the annoying part. It's an ultra-fine powder that mixes effortlessly. No grit, no clumping sitting at the bottom of your shaker bottle, no matter how hard or how long you swirl it around. That's the Momentous standard, the relentless pursuit of better in everything they make. My family switched to Signature Spec once I realized I'd been trusting a label without actually knowing what was behind it. If you're going to take creatine every day, make sure it's the best. If you want to try Momentous Signature Spec Creatine, head to livemomentous.com and use code SHEMD or SHEMD Pod for up to 35% off your entire first order. That's livemomentous.com, promo code SHEMD or SHEMD Pod for up to 35% off. Livemomentous.com, promo code SHEMD or SHEMD Pod. Talk therapy is so valuable. Having a space to process, work through things, understand patterns, that is real. But there are situations where therapy alone is not sufficient. This is where Talkiatry comes in. It's an online psychiatry practice, not therapy, not an app, psychiatry. You'll connect with real medical providers who can diagnose what is going on and, when it's appropriate, prescribe medication to help. They also handle the medication management over time, so you're not navigating it alone. I know trying to find a psychiatrist who is good and available can seem impossible. You call the one recommended, but they do not take your insurance. Or they stopped accepting new patients back in 2019 and nobody bothered to update their website. Talkiatry skips all of that. All 800 plus clinicians accept major insurers. Getting started takes minutes, not months. You get matched with a clinician who actually fits what you need, and you are in your first appointment in days. You stay with that same provider going forward, so you're not re-explaining your whole life every single visit. The treatment can actually evolve as you do instead of starting from zero each time. More than 300,000 patients have already found real psychiatric care through Talkiatry. So if you've been stuck in that gap between knowing something is wrong and actually getting help, this is the bridge. Head to talkiatry.com/SHEMD to complete the short assessment and get matched with an in-network psychiatrist in just a few minutes. That is talkiatry.com/SHEMD to get matched in minutes. Estrogen, when it drops, the dopamine drops. Is that what you're saying? And so does HRT help with ADHD, or is that the time that a lot of women should get on HRT, and will that help the symptoms that they think might be perimenopausal and menopausal?
Let's talk about when estrogen drops, because it's not just during perimenopause and menopause. Your estrogen drops right before your period. Every month that's happening. So people are getting smoked by PMDD and they think like, I'm having these horrible premenstrual symptoms and like life is falling apart for me a week before, and then I have my period and things are fine again. And so that happens. You also get horrific hormonal changes with pregnancy and subsequently postpartum. So pregnancy, your estrogen is actually pretty high. So you're like, I'm actually doing okay.
I'm great.
I could be pregnant for a while. This is fine. And then you have the baby and estrogen plummets. And then you're dealing with postpartum changes, and everyone thinks it's postpartum depression, postpartum anxiety. But it could be that humongous drop in estrogen is also complicated by this drop in dopamine. And so ADHD symptomology just kind of skyrockets at that time. It's a conversation that continues even outside of perimenopause and menopause because we've been dealing with it consistently this whole time. But when you get into those perimenopause and menopause windows, HRT does become part of the conversation. Now, whether that's appropriate for every person, yeah, it's a totally different conversation. I tell my patients, this is a tool in your toolbox. And whether or not it's appropriate for you is a conversation you should be having with your doctor, but you should be having that conversation. Just because you have this like golden window where you can approach HRT with it being helpful, where you have that upregulation of estrogen receptors, where you can actually make a difference on that. Don't miss that window. Talk to them. And if it's not appropriate for you, fine, we'll move on. We'll find something else. But that could be something that could be helpful for you. So I always encourage people to, number one, know about it. Number two, talk about it.
Well, so I've actually never heard ADHD and estrogen talked about together. So let's flip that. Let's say that, you're a teenager, you're postpartum, all of that. Do you think, because like you said, the dopamine drops, could the ADHD medication lift that back up? I want to talk to it from the lens of ADHD instead of hormones almost.
So here's the difference with ADHD medication and like HRT globally, is that ADHD medications, it will help. Like, for example, if we're talking about stimulant medication, which is typically what people are talking about with ADHD medication, even though it's a lot more broad. But stimulant medication, there was a study that came out of Washington University, and it was talking about the actual mechanism of stimulants are twofold. Number one, they increase alertness and that feeling of wakefulness. And 2, they point you towards reward. So they fight off those sleepiness cues. And 2, if you're pointed towards a direction, they're like, this is good for you, keep going. So those are the 2 reasons it works. That, in comparison to kind of HRT and the more global effects of all those other things it could be doing, limited. So is it going to help with ADHD symptoms that are worsened by perimenopause and menopause? Yes. Is it going to like globally change like all the perimenopausal symptoms and like that drop in dopamine? No.
So even postpartum, or if you have severe PMDD, you might need to be working with another, whether it's hormones or whether it's another SSRI or something that you're dealing with.
Potentially.
But I actually have never heard of ADHD medication even being part of that toolbox with the estrogen job, which is so interesting. So how do you decide what medication to use? Because I tried all these medication stimulants, you know, and it was too much for me, but it took me trying 15,000 medications. So how do you deal with that? Where do you start?
How much time do you have?
We have a lot of time on this podcast.
I could go on for you. Number one, to say that it's trial and error, it's a frustrating thing because I think that the more skilled the provider is, the more you understand those medications and what you're actually looking for, if you calibrate what your goals are, then you have a much narrower spectrum of medications to pick from. Part of what gives me that expertise in that space is I've been a patient and I've been a provider. So I've been through so many of these medication trials. I know what it feels like in your body. I know when you have a bad medication and I know when you have a good medication. I know what you're kind of looking for. It's such a collaborative process between you and the patient. So number one, believing the patient. I can't believe I have to say that, but that's a big thing because I have heard from a lot of patients. I went in, I saw my doctor, and instead of changing my medication, they're like, that's fine, you'll get used to it. Like, you shouldn't have to get used to something. But I think your understanding of what your target and goal is with medication is something that we should talk about more, because what I tell people is I don't want you to feel like you took a limitless drug. I don't want you to feel like you are above perfect and this is like life is completely different. I just want you to feel like you do on a good day. Like, I want a consistent kind of coverage that gets you around 80% of the way there. Because I want it to mimic the human experience. I want you to have ups. I want you to have downs. I don't want you to be so over-medicated that something triggers you and you pop off into outer space because you're so agitated or anxious or something like that. I want to get you I would never overcorrect and get you there, because I think, especially for a huge proportion of people with ADHD, they're so motivated in their own healthcare and finding answers that they also want to introduce behavioral mechanisms. What else can I do? And I think with medication, it allows them to at least build some scaffolding to support them. So I think that combination is really good. So I think that's also an important kind of thing, because some people expect, like, I need to be 100%. Yeah.
Right.
And I don't think that's a realistic goal.
How do you decide whether you're going to start with a stimulant, or do you always start with a non-stimulant and then move to a stimulant? Or does somebody come in and say, these are my symptoms, and if they're those, you go to stimulant, or if they're those, you go to a non-stimulant?
Yeah, it's so individualized. But what I will tell you is that I utilize a lot more non-stimulants than I think the average provider. And I'll tell you why. I use that class of medications because of that 80-20 kind of rule that I want to get to, because I would rather, instead of giving you 4 hours of 100%, which some people, they're like, that's where I want to be. That's like, I can get done. For me, I would rather, instead of that 4 hours, I would rather give you 24 hours of better coverage where you feel even. But the stimulants, you're so limited by this window of coverage. And I feel the contrast between being medicated and being unmedicated feels very vast for a lot of people. And so it's like, as soon as I'm off my medications, I can't do anything. And so I like these non-stimulants or 24-hour acting agents because it gives you that kind of consistent feeling. And then you don't feel as jerked around by the medications. And especially for the emotional side of ADHD, which I think impacts people so greatly, I want to give you coverage because you're not only going to be dealing with ADHD in that 4 hours window.
So I guess I was confused because I thought some ADHD brains, a stimulant is the only thing that will help them. And some ADHD brains, a non-stimulant. But if you have ADHD, use both a non-stimulant and a stimulant?
Totally dependent on the person. And I'm not saying anything badly against stimulants. Stimulants are a beautiful tool and they are so life-changing for so many people. And if it's appropriate, we go there. But also like the world we live in too with stimulants and like the amount of regulation and like if they take skip days like they're supposed to, and then they miss the window that they have to fill from the pharmacy, and then the medication expires and then they can't get it, or the pharmacy is closed on that day. And then, there's just all these logistics as well that makes stimulants hard.
Is there too early a time for children to get on medication? Because, as a parent, when you recognize that you have a child with ADHD, you don't want to put them on medication. That's the first thing. You're like, How can I not? But we were talking before the podcast, we were saying, actually, if you intervene with medication earlier, when you have neuroplasticity, it can be more beneficial. Can you kind of jump into that?
I wouldn't even say intervene with medication specific. When you intervene, so with ADHD, you can treat it behaviorally, you could treat it medicinally with like pharmaceutical medication. So there are different routes. And a lot of times it's this combination of both where you're using the behavioral things and the medication. I would say with kids, I do try as hard as I can to do the behavioral stuff first, to work with the teachers, get an IEP, get a 504, get like the school accommodations, work with the teachers, try to do stuff at home to provide this flexible structure that they need. But there are a lot of kids that's hard for them, and trying to get them to adhere to this structure and to grow and develop while everything is very chaotic internally is unfair. It's not going to work. And that's when you start looking at medication and what you potentially could use. And for those kids, it depends on the kid. Non-stimulants, an awesome option. Some kids need stimulants. It just depends. I, again, am so biased towards the non-stimulants because I think, especially for kids, I like the idea of having that 24-hour coverage. I like the idea of not suppressing appetite. I like the idea of not worrying about like sleep inhibition. So I like not having to worry as much about those factors.
I love my coffee and my Earl Grey tea, but if I'm honest, these can be really acidic. I've been paying a lot more attention to my dental health lately. Through our conversations with experts on the podcast, I finally connected the dots about how much damage my daily coffee and tea habit has quietly done to my teeth over time. I'm starting to notice it, and it's a very specific kind of unsettling. So when I found out about Larinco, I leveled up my chewing gum routine. Larinco is a better-for-you chewing gum that uses the same mineral your teeth are made of to support daily enamel health. And it works to strengthen your enamel and help repair damage, not just mask it or cover it up temporarily like a lot of other things claim to. They sent me some to try, and I am truly a fan. Most gum loses its taste after the first 2 minutes, but the taste of Larinco actually lasts, and my mouth genuinely feels fresher afterwards. I chew it on the go between meetings, and it feels good knowing I'm doing something for my teeth every single time instead of just chewing gum for the sake of it. It comes in so many flavors: mint, cinnamon, bubblegum, berry. So there's genuinely something for whatever mood you're in that day. It's a totally effortless way to make sure you're taking the best care of your teeth possible without adding one more complicated step to your day that you'll abandon in a week. Right now, Larinco is offering our listeners up to 50% off at buylarine.com/SHEMD. That's buylarine, LARINE.com/SHEMD for up to 50% off. Summer is a season where I have to be really careful about staying hydrated. We are having a heat wave in California right now, so this is especially important right now. Between warmer weather, travel, and long days on set, sometimes water isn't cutting it. That's when I reach for Drip Drop. I also have done so many podcasts with experts that say just drinking plain water isn't enough. On the days when my workout goes a little longer, Drip Drop has me covered. Drip Drop is doctor-developed, proven fast hydration that helps your body and mind work better. Because hydration isn't just something you do when you're behind, it's how you stay ahead. Drip Drop uses science-based formulas for rapid hydration, so you feel results fast. Drip Drop is trusted by firefighters, medical professionals, and over 90% of top colleges and pro sports teams because it's built to hydrate you faster and more efficiently than water alone. If you're avoiding sugar, their Zero Sugar Plus is a breakthrough fast-absorbing formula with an advanced blend of 5 5 key electrolytes, 15 essential vitamins and nutrients, and no sugar or artificial sweeteners. Fast hydration built with what actually matters. No crash, no weird aftertaste. And honestly, all of it tastes great. Right now, Drip Drop is offering podcast listeners 20% off your first order. Go to dripdrop.com and use promo code SHEMD. That's dripdrop.com, promo code SHEMD for 20% off. Stock up now at dripdrop.com and use promo code SHEMD. Something I have genuinely changed my mind about over the years is the relationship between gut health and skin health. I love when a supplement company asks, what if we could be more precise? What if instead of a generic probiotic that does a little bit of everything, we could actually target specific microbiome pathways to support specific outcomes? That is the thinking behind Ali Precise Probiotics. The skin support formula targets the microbiome connected to skin health to support hydrated, healthy skin and your skin's pH balance. You are working from the inside out, addressing your skin at a foundational level. Rather than a single broad spectrum probiotic that does a little bit of everything, Ali designed 3 separate formulas: stress support, skin support, and metabolism support, each targeting a different microbiome pathway. These 3 are designed to be taken on their own, not stacked together. So figure out the solution you actually need right now: skin, stress, or metabolism, and start there. You choose the one that aligns with what you want to support most. Wellness is not one size fits all. Precise probiotics are a good example of that philosophy in action. You can find Ali Precise Probiotics with skin, stress, or metabolism support at a Walmart near you. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. I found that my medication stopped working when I went into perimenopause. All of a sudden, something else changed. And so do you see that a lot with women where they enter a different phase of their life and all of a sudden they have to find a new medication?
Not even necessarily new medication. There was a study that came out very recently, within the past 2 months, where it was talking about how you dose for ADHD medications, specifically stimulant medications, within those premenstrual windows. So when there's a drop in estrogen, because your medication does not work as well. So you're being hit with 2 things. Number one, hormones have changed. And so estrogen drops, dopamine drops. Intrinsically, your ability to handle executive function tasks get harder, emotionally regulate, all of that gets harder. But then secondary from that, your medication metabolism changes. And so you might need slightly higher amounts of medication during that time. And so that is a well-documented phenomenon. And we're just, no one talks about women's healthcare.
Right. Which is why we started this podcast. Yes. Is there anything wrong with your child with ADHD? You get on medication and you take it for the rest of your life. Are there any negative side effects for your brain?
There just isn't a huge glut of information with longitudinal studies. There just isn't. Like, there's some that'll give you 18-year studies, and there's some that'll show you you're starting at childhood, but then you're not accounting for medication changes as you kind of go through. Some of the things you see, especially with high dose stimulant usage, is some like growth suppression. So that's something that you can kind of think about longitudinally. You also start to worry about, especially if you have a family history of cardiovascular stuff. We work with whatever science we have at the moment. That is how we occupy this space as physicians. And I wish we had this infinite bounty of resources. This is why people should study ADHD more. This is why people should study women more. This is why people should study adult women with ADHD more. But we don't have those studies.
Right.
So I can't tell you right now with absolute certainty, but I can tell you that even knowing what we know about, like, here are some of the risks that we look at, there's also risks that happen with undiagnosed and untreated ADHD. So you have to weigh those risks versus benefits.
So what do you think about medication holidays, just taking a break from your medication?
So you're looking at ADHD kind of as like this wide spectrum of presentations, right? And so there's some people that being off of medication is so disruptive to their schedule and their functioning that it is actually counterintuitive. There's some people that the way that a medication kind of break or holiday, even if it's once a week or, a couple times a month, it's enough where they're like, I'm not doing much. I'm going to just kind of reset. I woke up late. I'm not going to take it today. And it's enough to kind of reset and kind of counteract, like, their eating kind of improves that day, their sleep improves that day, and they kind of gather natural resources and then they keep it going. Because again, if you're thinking back to how, especially with stimulants, how they work, pointing towards awakeness and reward, like awakeness, what I'm talking about is they're counteracting the sleepiness cues. They're not giving you energy. They're just covering up that you're sleepy.
Okay.
Right? So the thing that's going to give you energy is sleep.
Right.
So if you're taking stimulants every single day and you're kind of working and building up this sleep deficit, drug holidays can be really helpful. The other reason they're really helpful is these medications inherently, you build a tolerance to them. They will not work as well at that dose over time. So I think drug holidays kind of shift that so you can kind of peel back from that and you don't build a tolerance as quickly.
We talked about the estrogen drops and the ebbs and flows. Does that affect when you need medication, how much medication you need? Do you think about that?
So because of that premenstrual period where you get that drop in estrogen, that's typically, you get lower dopamine sensitivity, you get lower dopamine regulation. Everything is being impacted. The dopamine you have is getting chewed up and eaten up and out of that cleft a little bit sooner. So your medication doesn't feel as effective during that time. So that's typically when you may need a slightly higher dose during that time. Now, there are other ways around it. Like you could just kind of rearrange your schedule to have a little bit lower impact during those times or things where you work around it. But for people who feel like they need medication pretty consistently and they feel like there's a stark drop off around that time, that could be what's happening.
So I really want to talk about your new book, Too Sensitive, and I want to talk about RSD. So can you tell our listeners what RSD is, and can we talk about the emotional side of ADHD? And I think it's there. It's so, I was an emotional child. I had ADHD.
Nobody talks about it. So let's first talk about RSD and then I'll talk about this book. Because I think this is something that, if I could shout this from the rooftops, I would. So RSD is rejection sensitive dysphoria. And it is this concept and phenomenon where you get this incredibly robust emotional, sometimes physical response to real or perceived rejection or criticism.
I have I totally have that. It's like somebody kicks me, and my sister, Meg, if you're listening to this, we work together, and when we have like a fight in work, it's like she's kicked me, and my response is like, I want to kill her. It is real.
It is a wound. And it is so, the thing that really kind of got me thinking about this is, number one, I have that too. So like this feels very personal for me, but almost 100% of people with ADHD have some component of this.
And it's called, say it when
RSD, rejection sensitive dysphoria.
Rejection. So we just don't like being rejected in any way.
I don't think anybody likes being rejected. Likes it,
but we just feel it physically.
But emotionally or physically. And it is the thing that gets in the way of relationships. It gets in the way of functioning. It gets in the way. This is the thing that's keeping you up at night. Like these are the things that are chewing at you. So I think that this, as a part of this emotional dysregulation conversation, it is such an oversight that that's not included in ADHD because it's such a huge part of it. It's such a huge part. And this is from looking at the patterns of thousands of patients that I've seen, but also like going through these experiences for myself. When you look at just day-to-day struggles with ADHD, if I can't focus, okay, man, I can't focus. That's bad. But I'm 40 years old. I've figured out a hack around it, or I've delegated this problem, or I have found like enough coping skills to kind of Frankenstein my way through. But I can't do that with emotions. With any task, if there's an emotional component keeping me from doing that task, that's the thing I'm going to procrastinate. That's the thing I'm going to avoid. That's the thing that makes it so much harder for me. So without looking at that as like a greater context about ADHD, I think you are doing yourself a huge disservice because as a woman, This is what people call anxiety. This is what people call depression. 100%. Now you're going through, and these women are like, oh, you feel sad about that? You have anxiety. You have depression. They're started on antidepressants. The people that I'm seeing, sometimes they've been on 10 different antidepressants at this time. Now they're like, oh, I heard about RSD online. I think I might have ADHD. Let me look into this. They go to their doctor and their doctor is like, no, like we can't treat this unless we get your anxiety and depression under control. If the ADHD is causing that emotional dysregulation, when are we ever going to get to talk about it? When are we ever going to get to the bottom of it?
It's so crazy. I mean, you're just opening the light bulb in my mind, because when I think of my ADHD, I think of it as a superpower. Honestly, I was unmedicated and it caused me to do, like you said, I have life hacks that could just wind you up and spit you out. I've created company after company after company because I have ADHD, because I was able to do all of these things. But that part of it, that part where the response to something is so much bigger than it should. It feels so much bigger. It's like, hey, they just disagreed with you. It's not a personal affront. It's not, that part of it. So that is, I'm so happy that you wrote this book. So what do you do with that?
Yeah.
So how do you fix that? How do you regulate that? I mean, is it medication? When I tell you, I have talked to every therapist under the sun, and we've tried every breathing technique and every single thing. And and I did get on anti-anxiety medicine because I felt that feeling was anxiety.
I know.
But it's probably ADHD.
Especially with what I have found with high achieving women. They have just hacked together their life at all of these different things. But it's the emotional stuff that you can't hack your way around. And so with this book, Too Sensitive, so it's called Too Sensitive, Rejection, Resilience, and the Science of Feeling Deeply. I wrote this quite literally because I couldn't find information anywhere. One, for myself. Two, for my patients would be asking about it. And I was like, I don't know. I don't know where to send you to. So it took 3 years of research and scraping and trying to figure out what the neuroscience behind it was. Because I was like, truly, for people that feel too quickly, too deeply for too long, there has to be something neurologically different. And there is. So neurologically, you're wired differently. The way you handle emotion is different. And so the first part of the book is talking about the neuroscience, and there's a huge part about hormones. There's a huge part, which was also you can't find that anywhere. It was so hard to get information. And then the next part of the book is an assessment. So you're like, how sensitive am I? Because I think that's part of the limitation. Like, how do you actually assess? Am I too sensitive? Am I regular sensitive? Like, what am I dealing with? So it ranks in this spectrum of, here is from this isn't something that bothers me to this is highly emotionally sensitive. Where do I fall? And then it goes into tools. And within the tools, they are pulled from every corner of psychotherapy and psychiatry and neuroscience for what works in the moment and what works over time. And then real world applications, because I think you have to see it. And for every single one of those real world examples, I'm like, I've gone through this hundreds of times. So I know that they belong in here. So
is there a certain medication that works? Are there certain tools that you have seen work?
So I think by the time after the 3 years of research, I whittled it down to a set of tools. They're pulled from DBT. They're pulled from cognitive behavioral therapy. They're pulled from psychodynamics. So stuff that works in that moment and unique ways to apply them, because the therapist isn't necessarily looking for what works for rejection sensitive dysphoria. They're looking for what works for anxiety. They're looking what works for depression. And so there's a set of tools that work. But then what I go into later is, if for some reason you can't progress past this, here are some of the medications and things that you can possibly use. And it talks about, is this kicked off by a hormonal component? Is this underlying anxiety or depression that could be confounding it? Is this that you need a non-stimulant? Is this that you need a stimulant? So it talks about all of that as well.
So excited. Thank you for writing this book for me. This has been so, honestly, I don't know why this isn't talked about. This is why I love this podcast. I love this podcast because I love learning this, but I also love being able to share this information because this is not talked about. And whether you're the mother of a sensitive child or whether you are that sensitive person, I think that this is going to be really so helpful. So you've talked on TikTok about dating advice for women that have this.
Yes.
Give me some of that advice.
So here's the deal. I think RSD in general leaves you very exposed and vulnerable. Dating, especially in the time of apps, also very vulnerable and exposed. Like that's just a difficult thing to kind of bridge that gap. So I think that one of the most important things with this entire process of dating, knowing your patterns. Because I think once you understand about RSD, and that's at least in your brain, that you have a name for it, that you have a term and a phrase for it, and you understand that this isn't just me. I'm not being too sensitive. There is something neurologically different about how I process emotion. I think that changes how you handle interpersonal relationships and conflicts and things like that. Because I think, looking back in my own relationships, a lot of those early dating stories, if someone would not text me back, or if they texted me back and God forbid they did the wrong punctuation, I would spin out about that. I would be so concerned, like an hour would have gone by. I would have created a completely different narrative. And my impulse would be to push that other person away because like, you're not going to hurt me further. I got to get out of here. And so there's so much of that by just knowing what it is helpful. The second thing that I think is incredibly helpful is opening up dialogue. And I think that a lot of people are scared because it is exposing some vulnerability. But just having those conversations, and within my marriage, that's something that I've had to do as well, where I'm like, that hurts my feelings. What you're doing is hurting my feelings. And I know you're not aware of it, but this word that you're using, this is what's catching me up. Can you use something else?
Yeah.
And the thing is that my husband, it has been like, so he's part of what encouraged me to write this book, because like, I don't want to get rid of my sensitivity. I think it's a beautiful, beautiful thing. I think it makes me a better physician and a better parent and a better partner and a better person. So I don't want to be less sensitive. I want to be more in control. And so I think that he was encouraging me to write this book because he's like, this will be so wonderful for people to gain control of something that they feel like has been so limiting.
There's so much noise with supplements out there.
Yeah.
Are there any supplements that work for ADHD?
So here's my thing. I mean, if I had to rank things based on like, I can't even base it on effectiveness because we don't have, like, the FDA is kind of, FDA for medications, you can at least look at it and be like, this is how it was studied. This is the phase 1, 2, 3, 4 clinical trial. Like, this is what I know about post-marketing kind of side effects. They don't have that for supplements, or at least they have some rudimentary system that doesn't look like the FDA. So you don't really know what you're getting and how robust those studies are. Because a lot of those studies you look at and it's like, well, this was put on by the company that was, you know?
Yeah.
So I think that when you're looking at supplements and you're looking at what has the best data just like globally for ADHD, you can look at things like omega-3 fatty acids, which help kind of rebuild that frontal lobe and give you a little bit more cushioning, because with ADHD, that's a lot of where that initial dysfunction occurs. Magnesium, especially magnesium glycinate, has been helpful, especially for people who run kind of more on that anxious side and have difficulty with insomnia. Those are probably the only two. There's a lot of talk about L-tyrosine, and there's talk about zinc, and there's talk about vitamin C. Yeah, all of those, I would say, it could potentially help. I just don't have science behind it to back it up.
We got a couple of questions from our listeners. So this has come up again and again. Everyone has a little ADHD. We're all distracted by our phones now. So are we, I say this to my child all the time. I'm like, you're giving yourself ADHD because you're just on that phone, scrolling. True or false? Are you, because you just said earlier, you're born with it.
Yeah.
And
it's
so
false.
You can't give yourself ADHD.
No, you can exacerbate ADHD. And there is something about like, and it's ironic for me to talk about because I am someone who is on social media, right? So I do create content. But there is something to be said about that short form video format and things like that, where you're just scrolling, and the way that those algorithms are based, they're very interest based. So the more you scroll about something you like, the more you see of that thing. And so it's very easy to kind of hyper focus and go down this rabbit hole, which is ADHD people love to do. Yeah. So I think that I don't think the phone is going to give you ADHD, but I think it will, using it responsibly as much as you can, and kind of like what I would say, and my child will hate me for this and I'm fine with it, is like delaying when kids first get their smartphones and things like that. I think that there's incredible value in that, and policing kind of what they do see and what they're exposed to, very important.
Okay, what do you think the biggest misconception about ADHD that you would love to retire?
First one is that it's just attention, because no.
We just talked about it.
I hate that.
Emotion.
The second one, and I think this is a big one, and it still stands for a lot of people, is that you grow out of it, that it doesn't happen in adults. And to that, it's like, well, where does it go?
Totally.
Like, what? You've just gotten really good at hiding it, maybe, but like it's there. So I think that there's a lot of people that maybe, especially like with the right type of structure and reevaluating, and maybe you can get to a point where it's not as impactful kind of later. But saying that you can't have it as an adult, that's insane.
Okay, we just spent a whole podcast debunking that myth. The ADHD hack you use yourself that you swear by.
I have a hard time going to sleep, just since utero. I can't, I don't understand how people, my husband says, the minute I put my head on the pillow, it's just blank. And I'm like, what? That's when I get my best ideas. That's when I get my zoomies. I
have a little a thing right behind me that I write on.
And that's what I was going to say.
I have to just get it right out.
I have to brain dump before bed, because then I don't have that urgency because what I do is I'll think about something and I'm like, okay, don't forget it. Think about it more. And then you'll definitely not forget it. And you're just thinking.
We have the same brain.
Yeah.
That's why I like you so much. I can tell right now.
Oh, that's what I have to do. You brain dump. And I think that has been a brain hack that I actually do swear by. And I feel like it has been incredibly helpful for my sleep. And it's like paper. I don't want to use my phone.
Honestly, and I'm so happy that you have written this book, because what we try to talk about on the podcast, not everyone can go see you. Not everyone can be your patient. So you have this tool now for so many of us that have never really even thought about the emotional side of ADHD. And we've learned so much today about medication, I don't know. Thank you so much. Dr. A and I met you and we just said, you have to come on the podcast. This is just, and you're just the best. So, no, I just thank you for all the work that you're doing for women. And I think it's not talked about enough. And if we can change one woman's life by listening to this, or one little girl's life, or one child's life, it's all worth it. So thank you so much for being on the podcast.
Thank you for having me.
Thanks so much for joining us today on SHEMD.
If you want to own your own health, a good place to start is by following us on social media at SHEMD Podcast, and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SHEMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SHEMD, some of the products and services we discuss may involve sponsorships or paid advertising.